Okay, we have Miss Zelda here today. Can I get you to verify your name and your date of birth?
My name is Zelda, and my date of birth is December 21st, 2002.
Great, okay. So what brings you in today, Miss Zelda?
My throat has been hurting. I've been having body aches and headaches,
Oh.
and I have fever for 4 days, and when I look in my throat, I have these little white things in them.
Oh, I'm so sorry to hear that. So all of the symptoms that she just gave us would be subjective because it's subject to what she's told us, right? She's had a sore throat. She said she's had it for how many days?
4.
Right, okay. She's having body aches. Are you taking any medications?
No.
You haven't taken any medications for it? Okay, so I'm going to go ahead and take your temperature,
Okay.
and we're going to place this under your tongue. Wonderful. Close your mouth. Great. .4 today. Wonderful. That would be objective because that's something that we can see. I'm going to go ahead and get your oxygen saturation and as well as your pulse. Have you had any trouble breathing, any cough?
I have some cough.
Okay.
Not so much trouble breathing.
Wonderful. Okay, so her pulse is 94 and her pulse ox is 99%. This again would be part of the objective data because we can actually see that. Okay. Did you get a flu shot this year?
Yeah.
You did? Okay. Well, what our company does, what our practice does, when you come in with these types of symptoms, we want to go ahead and do a flu screen for you and a strep screen so the doctor can know when he comes into the room in just a few minutes whether you're positive for the flu or strep throat. Would that be okay with you?
Yeah.
Okay, so to get the flu screen, what I need you to do right now, I'm going to need you to blow your nose. Wonderful. And the reason I have you blow your nose is because it gets all of the mucus and stuff down in there. So we can get lots of germs on the swab. Now,
Are you gonna get like a Q-tip and wipe it?
no, actually we're going to stick this up your nose. Is that okay with you?
Yeah.
Okay, it may be a little unpleasant, but this is how we're going to obtain the flu screen. If we were actually in the doctor's office and Brianna was our real patient, we would use the swab to actually stick in each nostril. And we would twirl it around in there and get all that good mucus that she gave us. And then we would do the other side, inside. And then we would transport the swab. You may need to sneeze. We would transport the swab into our lab where we would run the test. Okay, but since Princess Zelda, sorry, not Brianna, she is complaining also of a sore throat. Here's her throat because I can't show you what the inside of her throat would look like. So I'm going to test her this way. So in order to test your patient, we are going to need her, let me get rid of that glare. We're gonna need her to say, ah, for me real big. Great. Okay, so I'm going to hold her tongue down and I'm going to swab, 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 swab. And then I need to swab the other side. She's probably going to need to say ah again and swab over there. Now, take care when you're going from here to here that you don't drag across and hit the uvula, the tongue, or the cheeks. You have got to be very precise. So then I will take that and I'm going to put it in the strep screen tube where I will test that in just a few minutes. But I've noticed that Princess Zelda has these terrible white patches. We're gonna wanna know, is that an infection? So again, we're gonna use a culture swab, hold her tongue down, and have her say ah again. Go across, don't drag anything. All right, and we're gonna get all of that gook that's on her tonsils. We'll place it into a culture tube. We're gonna send this to the lab just like we would a blood sample. They will grow whatever bacteria is growing on her tonsils. They're gonna grow it in the lab, and then they're gonna see what is making Brianna so sick. So, now we're going to run a strep screen. So you're gonna have it in a tube like this. So we're gonna put, these are reagents. We have an A and a B. We're gonna put 4 drops of each. Okay, so I'll put 4 drops of the yellow. I'll put 4 drops of the red. Okay, that's not all we need to do. So now you actually crunch it and twirl it, and you get all of that yuckiness out. Get it into the liquid. Okay, and then we take this and we put it someplace safely. You don't want to come into contact with that. I just placed it back into the swab pack. Then we have our test. And I'm sure you've seen these types of strips before. And we're just going to place that in here. Each test kit may be different. We should be able to see a result in about a minute on this one. Then you would report back to the doctor whether it was negative or positive. It's always good practice to let the doctor know so he can tell the patient rather than to run in and tell the patient you have strep throat, because medical assistants should not be giving diagnoses to patients. So we know that we tested this patient and we tested the computer screen. So they're going to be negative. So we would write that down. You'll see 1 line. It's like a pregnancy test. You'll see 1 line and not 2. And that's how you're going to do your strep screen. So we're going to say goodbye to Princess Zelda.
Bye.
And you'll see another character in another time. Thank you. Let me know if you have any questions.